All right, everyone, I am here with Julia. How are you this morning?
I'm good, thank you. And how are you, Careen?
I'm very well, thanks. You guys can find Julia on Instagram at Pelvic Strong. So can you tell us a little bit about what you do?
Yeah, so I'm a pelvic floor physiotherapist, and I also work with musculoskeletal injuries as well. So that is where I started, personal training, musculoskeletal, and now I'm delving more into pelvic health. And this came about because as a trainer initially, and also as a new grad physio, I was seeing a lot of women who were experiencing incontinence, and that was actually affecting their training. So that's definitely something I'm passionate about. And at the moment, I'm working in Marrickville at a private practice called PB Physio.
Yes, you guys have an amazing team there, and I love the content that you share and what you're doing to help people. It's really awesome. And I think that's it too. Like a lot of women do experience that incontinence, and like what we're going to be discussing today, prolapses post-birth and even during birth and post-pregnancy, like a lot of hip pain and that sort of thing. And a lot of the times are unaware of these things or don't know how to prevent it or help themselves. So that's what we're going to be discussing today as well in relation to prolapses. And reached out to you initially because I've been on the phone with quite a lot of women who are either pregnant or post-birth, and I've been hearing all these crazy stories about how they'll go and see their doctor or a specialist and be told that if they have a prolapse that they'll never be able to lift again, and they're going to need surgery. That's the only option for them, and it frustrates me completely because these are professionals that these people obviously look up to and place their trust in, and then when lifting is such a big part of your life and you're told that you'll never be able to do that again, it can be quite confronting, and that's not always the case.
Yeah, and that's definitely something that I commonly see as well. So I guess it will be good to also delve into what a prolapse is, because there are different severities, and in some circumstances, depending on the severity of the prolapse as well, sometimes surgery is the option. And at the moment too, there is a bit of limited research on the recovery of surgery and lifting, and so usually most health professionals will go to the most safest option for the female, because there is a very high rate of reoccurrences with surgery, of failed surgeries, and that's probably the reason why. But as I said, and I have mentioned to you before as well, there are ways that trainers, coaches, and as health professionals we can try and help work around it as much as we can.
That's right. And I think just say we do go down the case of getting a surgery, and there may be some things that you cannot perform, like you may not be able to perform movements that are going to create a lot of pressure in through your core and your pelvic floor. But I get to the point, I'm like, okay, well, what can we do? There's got to be something that we can do. You may not be able to do those massive lifts that are creating that pressure, but there will still be things that you can do within reason, and that's where working with a health professional can definitely help. So let's take a couple of steps back and
let's do it.
Let's talk about what is a prolapse and how does it usually occur at pregnancy or post-pregnancy.
So a prolapse is when there is a descend of the pelvic organs into the vagina. So the pelvic organs, and I'll grab my pelvis here. So this is the pelvis. It always helps to kind of see and understand the anatomy first, and I believe that every woman and even every man should understand what the pelvis is, and also the structures surrounding it too. So having a look, this is the pelvis here, front on. So even if you want to have a feel to the bony prominence at the front, right in the front here, that's the pubic bone. You can feel that right below the belly button and down. And then we have our hip bones here on the side, so they're the top of our hips. So our pelvic floor muscles, we're going to look at it just from below first. So these are the superficial pelvic floor muscles that attach. So just going through that quick anatomy here. So from the front, we have our clitoris here at the top. we have the urethra where we urinate from, and then we have the vagina. And underneath that we have the anus. And if we go all the way behind and under, and I'll just turn it around now so we can see better, but that's our tailbone, our coccyx. So can you see already that our pelvic floor muscles attach all the way to the coccyx, to the front of the pubic bone, and then these are the sit bones here. So where you're sitting right now, it attaches left to right. So these are the outside muscles, and we can squeeze those muscles. So right now, if you think about stopping from peeing and you squeeze, can you feel how it's like near the front there? And if you think this time about stopping from farting and you squeeze, can you feel how there's a little bit of a squeeze through the back? So we have the ability to control these like the muscles out from the superficial end. But one thing that a lot of women struggle to do is the actual lifting process and feeling the lift. Lots of people are great with the squeeze, but we actually need to be able to lift. And so now when we look inside and deep into the pelvic diaphragm, so that's from over the top. So we can see already the coccyx right here, the tailbone. And the pelvic floor muscles attach all the way from there and again to the front of the pubic bone. So from inside, front to back, and then side to side. So again, these are the entrances there, but the pelvic organs attach from within. So we have the bladder here that sits at the front. And then we have the vagina here, which attaches to the uterus. So actually a lot of people term it incorrectly too, and a lot of people will just call everything down there the vagina, but the vagina is actually the muscular passageway from the uterus out. And often with the prolapse, that's actually where the prolapse will occur and come out and down from, is from the vaginal passage. And so we have, the rectum here. So the internal organs, the bladder, the uterus, and then the rectum at the back. So you can already see as well, this is where bub grows. So when we're pregnant, this is where bub grows. And then sometimes bub can press down into the bladder, hence the reason why a lot of people feel like pee.
That's why you need to feel like pee all the time.
And that's why incontinence can also increase during that time and after too. Or some women can get constipation. So again, if there's a little bit less space happening here, there can be a little bit of pressure or compression of the back of the rectum too. Or the bowel. So a prolapse is any descent of any of these pelvic organs, but it can also be part of the vaginal wall. So it can be the front of the vaginal wall, the back of the vaginal wall. And so, there's a few different things that can occur, different severities as well, which is often assessed when you have a pelvic floor assessment, an internal assessment.
So with the severities, do you kind of level them? Is it like level 1, 2, 3? And and how do you rate a severity?
So there are 4 different stages, and it depends on how low it has dropped. So depending on where the entrance is. So most women now these days will actually have like a level 1 at least, and that just is a little bit of a drop. And so now, like with a lot of studies, they're kind of starting to think like, what is actually normal? So if you are just graded with a level 1 prolapse, is that actually that serious? And and some women can actually freak out about that, but understanding that is really important. It depends on how it's rated, is dependent on how low it has dropped to the level of the hymen. And so that's the entrance there. So a grade 1 would be, it's still up like halfway. From the cervix, it will be kind of halfway through the vaginal passage. 2 would be at the entrance, 3 would be coming out, and then 4 would be a full prolapse.
So the organ sitting outside of the vaginal passage.
And that would be assessed in the clinic setting. So your gynecologist or GP or a trained pelvic floor physiotherapist, using a measure called the POPQ. And so that will usually require you to kind of really push really hard for longer than 6 seconds lying down, and that will show an increase in diameter or the prolapse coming down. And that's the most optimum way of assessing how how the level of the prolapse.
Prolapse, yeah. And if I've just given birth, what kind of signs and symptoms can I be looking out for a prolapse, and what kind of time frame should I be going to see a women's health physio or going back to my gynecologist or doctor?
Absolutely, yeah. So firstly, 6 weeks, you do have to have that checkup with your GP. And I would suggest that that will be a good time as well to check in with a pelvic floor physiotherapist or your gynecologist.
Yeah.
It is really important, and I do believe that it's often missed. So most women will go back to their GP after the 6 weeks, but they don't actually go in and get a proper vaginal assessment. The thing is that, like, there is more measurements made when you go and see a pelvic floor physiotherapist or a gynecologist. And it's not even just the pelvic floor, but also like diastases, like how are you using these muscles, and that's really important. So yeah, I definitely recommend 6 weeks. I do have some women who still feel really tender even after that 6 weeks. And so, of course, like 100%, you need to make sure that you're ready for it yourself. And you don't want to be forced into it. However, knowing that it is important to get it done sooner rather than leaving it for too long.
I agree. I definitely think a lot of women, they'll go to their GP at that 6 week mark, but they don't offer them go to their physio, which is something that I highly recommend too, because you just don't really know what's going on down there.
Yeah.
And like you said, with your abdominal muscles either, without getting that full assessment.
Mm-hmm. Yeah, and in regards to symptoms, the most common symptom for a prolapse will be heaviness. So a feeling of heaviness like deep down in the groin or in that lower abdomen region. A feeling of a bulging sensation or a dragging sensation in the vagina. That's another thing that is the most common to feel. And some women will see or feel it when they're wiping or they're cleaning as well. Themselves.
Okay.
Yeah.
And so if we're noticing those signs and symptoms, definitely go get yourself checked out, and then we can take the appropriate steps to healing that prolapse.
Mm-hmm.
And so talking about the process and the treatment, if I was to come in and see you, you talked briefly about the assessment process, and then I guess depending on the level of the severity, what's generally a next step?
Okay. Yeah. So again, most important thing is giving the woman, the person, like the chance to actually, like, I guess, make that decision themselves by understanding all the different options. So some women actually aren't affected by it. So even though they may have a grade 2 or a grade 3 prolapse, I've actually had women who actually don't feel it at all, but they've been told now that they have the grade prolapse and they're freaking out, and so now it becomes an issue. So everyone does have a right to not do anything if it's not symptomatic. So if you're not feeling like you're stopped from your daily activities, then it's something. Then the other option is conservative treatment. So that actually, there's a lot more research now about conservative treatment, and that requires that 4 main things will be changing certain lifestyle like making certain lifestyle changes. So that would be like, not eating properly, because having a higher BMI, so being overweight, does cause more pressure in the abdomen, also down into the pelvic floor. So making those healthy food choices, and then also having a healthy bladder and bowel habits. So making sure that you're not holding in, you're not straining when you're pooing.
So it's ready to come out, guys. And a nice fiber-rich diet.
Fiber, that's right. So having the right amount of fiber in your intakes, your daily intake, so 25 to 30 grams, but drinking enough water too, because some women have way too much fiber, not enough water, and then it does the opposite
as well.
So making sure you do those things. The other thing is also pelvic floor. So there are studies that show that strengthening your pelvic floor does help. Even though with prolapse, it's actually a a like damage or stretching of connective tissue. It's not just the muscles, and that's why prolapse occurs. Yeah, because our internal organs that we talked about before, the pelvic organs, it's connected by connective tissue and fascia. So it's like a sling, and you know, with like chicken breast, when in between chicken breast we have that white layer that wraps around, and so the sheath, and we have that inside. And after giving birth or after abdominal like pelvic surgery or increase in weight and pressure, that can get stretched over time. And so pelvic floor muscle strengthening will help to a certain degree, and it is really important. It's like that second line of defense that helps to hold.
The stronger our muscles and our connective tissue and that sort of thing can be, the more it will be able to withstand to a degree. When we are pregnant, that pressure is going to be able to hold things a little bit better for us.
Exactly. Yeah. And then the other thing on top of that with pelvic floor strengthening is the use of pessaries. Have you heard actually much about pessaries as well?
Only a little bit, because you did mention it. So I went on there and did a little bit of research. And I was really interested in how you would use that as a tool to help someone with a prolapse.
Yeah. I'll show you one type of pessary because there are many different types of pessaries. It's like finding the right bra or finding the right pair of glasses. It really depends on the type of prolapse, and it depends on the woman's like anatomy as well and what they can use. But this is an example of a ring pessary. So this is probably the first type of pessary that might be used. It's the most conservative and easy to manage type of pessary, and it's quite malleable. It's made from silicone, and what it is, what's done is it's placed into the vagina, and placed into there, and what it will do is sit up and in, so it'll be inside here and help to kind of hold and support within.
So right up against the cervix, and it just provides that little bit of support during the healing process.
So it does depend. So for some of my mums or women who want to continue training and they experience issues during that, we will use that whenever they train. For some, if their prolapse is quite low and they can't engage their pelvic floor, because sometimes it can obstruct the bowel, or it can also minimize the lifting process of the pelvic floor. It's a way of using that to help offload so you can strengthen the pelvic floor. Some women will use it for the rest of their lives, and some actually will stop using it to a certain degree. So I had a mum who was a trainer as well, and she was experiencing that heaviness whenever she would squat, and that was like quite light at that time because she was just starting and she was really worried about it. We only needed to use the pessary, I think, for a few months, and she still continued with pelvic floor strengthening, and she continued to train, got really strong, and now she doesn't experience any issues, and she's like, even the other day she deadlifted like 140 kilos. But so like process wise, again, study wise, it's still like we can't say 100% that that's the way it's going to be for everyone, but in some cases it actually does really help.
Well, I think it's great to know that there are tools out there that you can use that are going to help you, and obviously depending case by case basis, it's something that you may be able to use for a short period that's really going to help you, that you can slowly kind of not use over time. Definitely knowing that those tools, as well as practicing our exercise and getting treatment from someone like yourself can definitely help. And in relation to trying to avoid a prolapse, like can we 100% avoid them? What can we be doing either pre-pregnancy? I just think it's important for everyone to be working on our core and pelvic strength, regardless of preparing for a baby or carrying a child. But what can we do specifically for that region that is going to help strengthen our muscles to kind of reduce the chances of us receiving a prolapse after birth?
So can't say 100%, like, unfortunately. I wish I could, but there is nothing at the moment that will be like, okay, this is going to prevent you from having a prolapse. And so, like I said, the main things, like knowing what causes prolapse is like really important. So the chronic constipation, So years and years of straining and pushing down, chronic coughing. So people who do tend to cough a fair bit, but unable to control that. Yeah. So again, that increase in pressure. So trying to manage those things first, like that's one of them. Weight management as well. So again, like I mentioned, if we are overweight, there is more downward pressure on the pelvic floor and the connective tissue, and that can lead to the prolapse too. In terms of lifting, so people who are heavy lifters, like athletes, making sure that you are doing it correctly. So yeah, seeing a like a coach or a trainer and making sure that your technique is correct. You're not bearing down, you're bracing correctly. So I'd say like breathing techniques, bracing techniques are extremely important. Yeah. So those are a few things in terms of day-to-day to make sure. In terms of pregnancy, like you said, making sure that you are using your tummy muscles, your abdomen correctly and properly, your pelvic floor, strengthening your pelvic floor throughout pregnancy and afterwards as well. In saying that though, again, I'm very mindful of saying strengthening because not everyone should do pelvic floor exercises. So we can have the opposite, and we can have some women who have really tight pelvic floor muscles and unable to let go. And so for them during birth, if they are giving birth and during labor, they can have more issues of tearing and issues of like affecting the pelvic floor if they cannot let go and relax those muscles.
And I think that's something again through the programming that I do with my girls is, yes, we want to make sure that we're strengthening this area, but we also, towards the later stages of birth, we want to focus on our breathing techniques and really kind of relaxing that pelvic floor region, because the worst thing that you can do, and I learned this from experience, is when you're laboring, tighten up. It is a lot more painful. You really just want to relax everything and let that baby come out. And like you mentioned, having that nice and relaxed, it reduces your risk of tearing as well. And, you're more likely to be able to have that vaginal birth without any complications if you can relax that pelvic floor and let bub pass.
Yeah, and I know it's easier said than done because during the process, I'm sure, is like you're not even thinking about that. Like you don't even know what to think about, So, but yeah, preparing for it and, doing the most that you can do to prepare for birth and labor, that's definitely something that's important. I would even still recommend some women who have already elected, like, for a cesarean section, still knowing these things, because just because you have a cesarean doesn't mean that you aren't going to have like a prolapse down the track. And like I said, there have been some women who haven't had kids and still can experience a prolapse. So there are all these other areas in terms of like also as we age, our hormones do change and our estrogen levels do drop, and that actually does affect our connective tissue. So even if you haven't had a child down the track, it can be an issue. For some women who haven't had any signs of prolapse younger after pregnancy and they ignore like any pelvic floor, any breathing, later down the track as you do get older, it can become an issue. So you still want to make sure you pay attention to that.
That we're conscious of it, and we're using the appropriate techniques when we're training and just in everyday life and that sort of thing. Another question I was going to ask, but I can't remember now. So in relation to training our core and our pelvic floor during pregnancy, a lot of women have that misconception, and you always hear like you shouldn't do core exercises, which isn't always correct. Working on strengthening the core, and when I mention the core, I'm not talking about like our six-pack muscles. We're talking about everything, those deep core muscles, our back. I even like
diaphragm.
I like to sneak the glutes in there as well, because they're a really important muscle to help stabilize through our hips and our pelvis. So are there any exercises that you would recommend for our core stability and strengthening during pregnancy?
Yeah. So there is so much like fear amongst women, particularly with the diastases during pregnancy and after pregnancy, and then also putting pressure on the pelvic floor with sit-ups. But like I will say that there was a study that showed that the pressure that you get in the abdomen from sit-ups or down in the pelvic floor region, with sit-ups, the pressure there is nothing like even close to a sneeze or a cough. And so that's actually more, and standing up from your chair is actually a little bit more precious. So that is and I always say, as a mother, you are going to have to get up and off the bed carrying your bub most of the times, and that is a flexion based movement. You're going to have to bend over to change diapers, wash and clean, pick things up. And so if you are so fearful and you do not train your body in those positions, you're going to struggle to do it day to day. And you're not going to do it either. So in terms of exercises during pregnancy, I always look at the level of the woman though. So it depends on how strong they are and their background. You still want to have a look at, if they're bracing and they're holding their breath and straining, then obviously it's a little bit too much, and you need to pull back a little bit. I probably wouldn't do too much flexion. I don't do too much flexion work for women during pregnancy, but I might do some like curl downs using a band, so sitting up and doing like a spinal lower, like if kind of a reverse crunch almost. Those ones are really nice because it actually still trains the muscles and segmental movement, sitting back and still engaging, but you've got a band as well, so you have control. A lot of other banded exercises like rows in like kneeling positions can also allow you to use your glutes, use your core, like abdominal region, but also your back muscles as well. And training that with breathing, I really like more of those movements because later down the track as well, breastfeeding, carrying bub, you still need to get the upper back.
We're gonna be I really like a Parloff press. Or
I love
isometric. Especially like you said, kneeling or half kneeling. I like to program them as a progression throughout pregnancy. So, we're still really working on that core hip stability. That anti-rotational I think is a great one. I like to use exercises, especially
like bird dogs.
As well. Great. Early stages, even just things like heel slides that are really helping focus on drawing that core up as we're pulling the leg forward. Even something simple like a side plank, things that I like to use as well. So they're all, quite suitable core exercises that you can safely perform during pregnancy. Obviously, if anything feels uncomfortable, I always just advise just to stop at that point in time and then just reassess.
Absolutely. Like I saw, and some women are really scared to plank as well. And there's been so many of my athletes who can still plank fine on their toes, and like some are still. So I have an athlete, a powerlifter in the US, and she has twins, and she's lifting still at like 100 kilos, and she's fine because she's at that level. So again, it depends. Like it's not about, I guess, comparing and making one like generic template for everybody, because everyone is different. But the main things and the key things to look at is, number one, you shouldn't be holding your breath and straining, and you're not trying to do like PBs and PRs at that point in time. You want to be looking at like what the belly is doing. So yes, if you are seeing an increase in like doming or bulging, bulging of the belly, that's so that's pressure coming through, and you want to either be using your breath to help you, or maybe that exercise is a little bit too much and you need to modify it a little.
I've actually got, I'll probably try and pop a picture up here somewhere, a picture of what like a doming or a bulge can look like on my Instagram page. So if that does happen, that just means there's a little bit too much pressure coming through the abdominal region. And like you said, really just focusing on our breathing patterns, making sure we're breathing throughout the exercises, using our diaphragm as much as we can, because we know that when you use there, it does impact our breath a little bit. And just doing what you're capable of as an individual. And like you said, we might have an athlete who can work up here, or we might have more of a beginner trainer who's going to be working a little bit more down here. It's appropriate to the individual for sure.
Yeah, yeah. And on top of like the breathing, that exhale, like that breath out is really helpful for minimizing that pressure in the belly, so that intra-abdominal pressure, because pressure will always want to go somewhere. So it's either going to go through in the front of the belly, down, but if you're exhaling through exertion in those tough presses or the tough pushes, then you're going to minimize that pressure down. Also, the other thing is like making sure that you're not pushing downwards too. So that's why you shouldn't be feeling that need to urinate or to fart or to poo during those times, and that's also another sign that you may be pushing down or bearing down.
Yes. So let's just say we do you do an assessment and we do have to have a surgery for our prolapse. Can you help with the recovery process after a surgery?
Yeah. So it is still advised, even after surgery. Again, about 50. They do say about 50% of people have recurrent like need for surgery, and it is really important to firstly, like any surgery in musculoskeletal physio, before surgery we always go into prehab. So you want to strengthen and get as much tone in that area before you have surgery, to help you with your recovery afterwards. It'll be faster and better too. So then you have your surgery, you have a bit of a rest. So usually they'll recommend like 6 weeks of like just very like first maybe in like it depends on the surgeon, but like between 3 to 6 weeks of just really light work like walking or swimming, and then after that you can reassess and see. So it is, again, it always comes down to what the surgeon has talked about or mentioned and the protocol that they have given. But then afterwards we can go through again making sure that you are using your pelvic floor correctly, because you need to be continuing that actually throughout life. You want to actually, it's probably one of those forever exercises that you want to try and remember, because if we don't use a muscle, it will get weaker, like any muscle. And so it is important that you have the follow-ups. Even after getting a pessary as well, you do have to make sure that it's really important that you do follow-ups, because with pessary use, with surgery, there are always like issues that can occur, so it's not always 100%. So you need to make sure that you still see your gynecologist, you reassess with your pelvic floor physio, and make sure that you're doing the right things. Exercise can then be modified and depending on what you can and can't do.
And like I said, I think it's always great to go see someone like yourself, because just having that guidance, and even after the initial phase working with a coach as well. So I'm like someone like myself, and I love being able to connect with physios, so we can make sure that we are on the right track and, doing the appropriate treatments and exercises to get the best possible outcome for the client.
And that's the main thing, right? As a coach and a trainer, like I guess you're the one that is actually going to be supporting them through their toughest times, and you're the one that will be there for them most of the time. So I love that you have reached out and you're trying to find more information to help your clients. It's so important, and I do really think that it's important for like health, like allied health, to work together with coaches and trainers,
100%,
for the best of our clients. Otherwise there is this disconnect. Like everyone needs to be working together.
I like to say that I know a lot about a little about a lot, but I'm not a professional in this area. So if you're a coach too who has a woman who's having a client who's having these issues, definitely refer them to someone like yourself. And doesn't mean you're going to lose the client. It just means you're doing the best thing for your client, and your client is going to appreciate that. I would rather know that client is getting the help that they need and working towards their goals than, I guess, causing more damage and being unaware of what's going on.
Yeah, absolutely. And like the main thing here is like, even though prolapse isn't like, it's not life-threatening, it can affect many people's lifestyles in general.
Yeah, and quality of life too.
Exactly, quality of life. Yeah, and exercise helps in so many ways, and we have so much more research saying that exercise helps with, obviously, like minimizing obesity, like chronic conditions, also with like osteoporosis and like muscle sarcopenia, so when people weaken over time as well. And so we still want to get people training and exercising and not letting something like this stop them entirely from doing that.
Yeah, and I think that's a big fear is a lot of the time, like you find out you have a prolapse and you're like, oh, I can't do anything. And yeah, it's not always the case, but it's definitely a process.
Mm-hmm.
And it will take time.
Yeah, and there is support out there.
Yes.
You just got to find it.
Yeah, definitely. And don't be scared to get a second opinion. I think like if you go see someone and they're like, no, you'll never be able to do X, Y, Z. Like I just personally wouldn't accept that. I'd be like, okay, well, I'll go work with someone who can help me. I may never be this power lifter, but what can I do?
Yeah.
That is going to help me, live the lifestyle that I enjoy, going to make me feel good, and going to help strengthen everything that I want to strengthen and continue to work towards my goals.
Yeah. And if it's exercise that you want to get into, then you are better off finding someone who has that experience in it, because sometimes if as a professional as well, if I'm not aware of what the movement requires or what certain thing needs or what it takes for the body, then I can't necessarily tell the person, yes, you can do it. So it is important that you find someone who has that background and knowledge and then work together with them.
Yeah, I agree, 100%.
And how about your own experience, if you don't mind, as well?
Yeah, I just put my hands down to strength training, and just education and knowledge is a massive part in that, and being aware of how to activate my pelvic floor, what that feels like, and being able to relax that as well for the birthing process. I've been, so lucky through both my pregnancies. I haven't had any pain or discomfort, which has been it was so good. Both my birthing experiences were, amazing. And like minor abdominal separation post-birth, no issues down there, which is, so it's all been great. Yeah, no incontinence. And I definitely think, knowledge and applying that knowledge has definitely helped me have really healthy pregnancies and postnatal experiences.
That's amazing. That's great. And now, you can share that knowledge and experience as well with other women too.
And I guess that's just why I definitely am so passionate about continued strength training for women in general, but definitely continuing your strength training through pregnancy, and then appropriate after as well, because even after pregnancy, it's like, well, you can't train for 6 weeks, and it's like, well, everyone's going to be different, but we can still do basic movements. You're already getting up and down, picking up your baby, to a degree that can be classed as strength training in a way, incidental strength training. So I'm really just excited to be able to educate women on, how the benefits of strength training and how it can make you feel and help your pregnancy and reducing or eliminating those aches and pains and the issues that you can face post-birth as well.
And like you said as well before, in terms of knowing as a preventative measure, if women have been trained to lift correctly, breathe correctly, and have the strength prior to pregnancy or during pregnancy, postnatally it actually becomes a lot easier for them. And so I find that if they understand how to lift their bub better and they can do it well, then there's less issues or straining compared to being scared to do it. And then when it comes to strength, like you said as well, you have to lift your child. There's no way that you can look after your child. So I usually like to use your bub, the women's bub, as their weight goal. on like how much they should be able to comfortably lift, and that's a way for them to still train their body and keeping up with their growing bub, which happens really quickly too.
Yes, it does.
Yeah.
So quickly.
Yeah.
Yeah, and I'm really excited like to catch up with you again and just run through like what we can do postnatal as well in terms of our strength training. And because a lot of women do fear kind of any sort of movement after they've given birth. And obviously everyone's circumstances is going to be different. Like if you've had vaginal or if you've had a C-section, which is major surgery and does require a bit more time. And obviously, if you do have prolapses and that sort of thing, the process will be a little bit different. But there are still things that you can do to keep up your strength and improve it over time. So, you feel better, you're moving better, your body's functioning properly, and you're not getting those aches and pains there as well.